Both of these patients have recession and need gum grafts, but the procedure and the techniques are completely different. In this situation, this patient was referred to us due to the severe bone loss and thin tissues that exist in her mouth. She needs a gum graft. However, in doing the procedure, we will never be able to cover the roots of the teeth because she has lost the existing bone structure. Our goal in this situation is to thicken out her existing very thin gum tissues and give her thicker gums in order to be able to keep her teeth clean and prevent further bone loss. This procedure, we completed a free gingival graft. We take tissue from the roof of the mouth and transplant it to the area where the patient is deficient. And as you can see, they now have a very thick band of gum tissue, is what we call keratinized tissue. Keep in mind, in this situation, we're not doing a cosmetic procedure, meaning we're not going to be able to cover the roots and make it look like it was naturally. Our number one goal is to give you thicker gum tissue. So there's always going to be a color discrepancy, and there's going to be this thick band of gum tissue that's very present and obvious, but that's exactly what we need in this case. Here we have a different patient with a different problem. They too have recession, however, they have not lost the existing bone underneath, and therefore you're not seeing those black triangles. These triangles are pink because they are filled with gum. In this situation, we are going to go for what's called root coverage. We're going to be able to cover the roots of the patient, but also thicken out the gums. This procedure is called a connective tissue graft. We take tissue from the roof of the mouth as well as the free gingival graft, but from a different location. We are able to thicken the gums out, cover the roots, and give the patient a beautiful aesthetic result. So in comparison, a CTG is always going to blend more naturally to your teeth because of the way you present initially. Remember, you have to have some kind of bony structure underneath your existing gums in order for us to be able to complete the connective tissue graft procedure. In comparison to the free gingival graft, you're never going to be able to get root coverage, and you're always going to have that thick band of gum tissue that may or may not be as pretty as we'd like it to be. So in comparison, as you saw, this patient presented and they've already had bone loss. That's what these little black triangles are in between her teeth. This patient presented and they do not have these black triangles. Both patients needed gum grafts, but the technique that we use and the procedure that we completed for them was different. In this case, we did an FGG, a free gingival graft, where we're going to thicken the gum tissue out. It may not be as pretty as we discussed, but this patient has some nice thick gum tissue in this area. For this patient, we were able to cover the roots, give them thick gum tissue, and we got a very beautiful aesthetic result.